Hey guys, Dr. Derry here, owner of Vision Health Services, and I want to talk about a topic today that's near and dear to my heart. So, disc herniations, what they are and how do they happen? So, disc herniation in nature, when you say herniation, there's the assumption that there's some sort of part of your disc, mostly the water substance, gelatinous substance inside the disc, the annulus that protects it, this fibrous cartilage that has this fluid inside of it. Something happens that this fluid exits that disc and heads towards the spinal canal. So the spinal canal is where the spinal cord's at. And most of the time, this happens towards the back and off to a side. And so we have some other landmarks in that prevent it from moving straight backwards. And so off to the back and to the side. And sometimes, just sometimes, that will cause a nerve discomfort. And so that nerve discomfort can be pain down your leg and your buttock. And so I've talked about that before. But the reason why that's near and dear to my heart is that this actually happened to me. And so I was not lifting the proper amount of weight without being ready for it. And I had some sort of butt discomfort that started. This was when I was in physical therapy school. So I wasn't really sure what happened. It really took me a little bit of time to dive through it. But it's near and dear because I got through it. It happened to me. I had MRI confirmation, and it did bother me with some things that I did during my day and my workouts, but I was able to get through it. And actually, the literature shows that they're common. You can recover from them, and actually, sometimes that fluid gets absorbed from your body. Actually, not sometimes. That is what happens. And so, over time, that fluid is absorbed from your body. And the actual inflammation that sits around there is what gives you that discomfort. And so when you have that little bit of disc material that goes inside your spinal canal, you have an inflammatory response. Your body says, whoa, what is this? What happened? What's going on? And that inflammatory response is what gives you that discomfort. And so sometimes you'll notice that if people have disc herniations, they'll be offered injections and they'll try to inject that area, some sort of steroid medication to help reduce the inflammation. And it helps sometimes, right? And they have to do some sort of guided imaging to allow to get the injection to get the right place. In the area that they do it, they kind of rely on your symptoms, where you feel it in your leg. And that's all kinds of things that we go over in the initial evaluation and what you feel. But what is a disc herniation? So a disc herniation is when that fluid-like material exits the disc and it goes so far, maybe it goes into the spinal canal. And so there's some levels below that. So this is disc bulging, and even above that, even a little worse. And so when you really look into the literature and what we have found, and that a lot of asymptomatic people, which means people without pain or signs or symptoms down their leg, into their back or their butt, actually have these herniations without any types of symptoms. And so they have the sign of the herniation without the symptoms. Pretty cool, right? And so we're walking around with this stuff. And when they do an MRI and they look at, okay, we're going to do the MRI because you've had this pain for a long period of time, right? We don't need the MRI right away. So let's say things are not getting better. You're 6 weeks in, you get the MRI and it shows L5S1, most common area disc herniation. And it actually shows that like L4, L5 has some involvement, L3, L4. That's normal, right? And that's not correlated with your signs or symptoms. And you may or may not have had that for a long period of time. And so it really just has to match with the physical exam. So the physical exam would include some myotome, dermatome testing, and just some things that will allow us to look at your nervous system and your back and see how it goes. Now, why do the disc herniations happen? We have maybe some evidence to show there's some genetic component. I'm going to reach into my expertise here a little bit in my experience, and I have seen that herniations happen for a couple of reasons. One, you try to do too much too fast, and so too much weight too quickly, or a weird awkward movement into the lifting that you haven't done normally, and you go into the movement, and that's what happens, right? You have that little bit of forgiveness or that incident in your back that causes either your back to spasm up or immediate leg symptoms or back symptoms. They're really variable. You could just have back symptoms. You could just have leg symptoms. You could have both. I mean, man, there's so much variation when it comes to disc herniation, and that's what makes it tricky, but yet fun to treat. Also, I've seen people, maybe they're a little overweight or maybe they're not as strong as they should be, and that's what can lead to a disc herniation. But I will tell you, people are 100% capable of recovering. And if you're worrying about things getting worse, then that's why you bring on a provider on your side that's going to look at your physical well-being and look at your back and your legs and the nervous system and kind of where it's at. And so Disc herniations, common, more common than you would think, especially in people who are younger, even or older. And just over time, that this disc material has a greater chance of exiting because the annulus, the outside area, degenerates over time. Degenerative disc disease, right? We've heard of these words before. Just normal aging over time that may lead to an incident of vulnerability. But if you build up your resiliency, build up your back strength, get some confidence, learn how to pick some things up, pick some heavy things up to give you that resiliency, that's how you get that bulletproof back. And so disc herniations, common. What causes them? It's probably multifactorial. And so you just really got to look at your body and your situation and really what causes. Will it get better? Absolutely. And so hope you got something from this video. Man, this is really fun to treat because I've seen people really turn the corner once they have a better understanding. So until next time, stay healthy, keep moving, and please reach out if you have any questions or comments. Take care.